Time now for the live coronavirus update for San Antonio and Bexar County. Over the weekend, we saw a backlog of cases added, and we're still watching the impact from Labor Day. Here's that press conference now.
Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolf. Tonight we're joined by Dr. Golare Aga, the Queen of Data, and also the Chief of Informatics for Metro Health. This is our San Antonio Community COVID-19 update. We're reporting 63 new cases of COVID-19 tonight, which brings our total to 57,208 since the pandemic began. Our 7-day moving average has dipped nicely to 139 because we've had, again, those 2 days, we've had below 100 below 100 cases come in the last 2 days. Fortunately, we also have no new deaths to report tonight. We do, again, want to keep those who have lost loved ones, colleagues, neighbors in our prayers tonight. We have lost far too many people during this pandemic, and so please keep them in your thoughts and prayers. Tonight in our hospitals, there are 220 COVID patients. Our total positivity rate is 6% in the hospitals. There are 22 new COVID-19 related admissions to the hospitals since yesterday, and we have 86 patients in the ICU, 34 patients tonight on ventilators. It is Monday, so let's take a look at our progress and warning indicators, those indicators that we're ensuring we're moving in the right direction here in San Antonio during this pandemic. And this week, we've adjusted our risk level titles to better reflect the situation. COVID-19 remains present in our communities, so while we are still in the green zone, the actions you take will determine your level of safety from the virus. The green zone is now being called a low-risk zone, which matches the labels you've seen in our school indicators. And the low-risk zone still means you should wear a mask, keep 6 feet of distance from others, practice good hygiene habits like washing your hands frequently, and staying home if you're sick. We're still continuing to see positive trends in our warning indicators. The 14-day case curve remains in a steady decline, and we continue to have ample testing and contact tracing capacity. We're still seeing also gradual declines in our daily hospitalizations, which is good, but we need to keep working to decrease this number overall. Our doubling rate remains at more than 3 months, and I'm happy to report that our positivity rate, which had moved in the wrong direction last week, is back moving in the right direction again, and we are now at 5.9%. Remember, the goal is 5% or less, and that would be the indicator which we can begin to open up schools at full occupancy. This week, our hospital stress score improved, so we're closer to reaching the normal range, and so overall, San Antonio is in the green low-risk zone. If you do go out, remember to mask up and practice physical distancing. And stay tuned to the city's website for more information. And again, tomorrow night, we'll be going over the school indicator data. Let me turn it over to Judge Wolf.
Yeah, thanks, Mayor. Say everybody out there is entitled to a Labor Day certificate for extraordinary conduct beyond the call of duty. Our numbers now, 3 weeks since Labor Day, are really looking good. The last 2 days have been in double digits only, 56 and 63. So I think we've passed that hump. Now we're into the school hump, and now we're into the flu season, that we need to continue to do all the things that we know we need to do: social distance, face mask, sanitation. If we'll keep that up, we're going to get ourselves through the flu season and have success in our schools also. When the mayor was mentioning all the stress scores that we have, you know, our hospital is right close to normal now, a little bit better, and we're going to get down in the low zone. He mentioned the 5.9. That's better than the 6.4 that we had last week in terms of positive rates. And we're able to contact way beyond what's happening now. We've got about 152 new cases a day. We can handle up to 1,400. And then our testing capacity is 3 times what we're experiencing. So we're really staffed up, ready to go if anything goes wrong. Hopefully it's not going to go wrong. Let me mention this. You're going to be getting, those of you that are 65 and older, you may get as many as 3 or 4 or 5 of these. I got another one today, which is the mail-in ballot. It's a really simple thing to apply for the mail-in ballot, but you only need to do it once. So pick one of those that come across your desk and fill it out and fill it in. You're doing yourself a service by not having to go to the polls. You're making it easy on our election officials. You're helping with the fight against the COVID. So I would encourage you to vote by mail. If you're 65 and older, you got that right to do it. If you're younger than 65, you still have a right to do it if you have some medical condition that doesn't allow you to go vote. So just because you're younger than 65 doesn't mean you can't do it. So take advantage of the mail ballot. Help save all of us from the COVID issues that we're facing, because you don't have to wear a mask when you go to vote. Unfortunately, the governor didn't require that and tied our hands on that. So take the safe route. Do the mail-in ballot.
Great, thank you, Judge. And again, credit to all of you who've been working so hard to get this infection back under control. Let's continue to work hard. If you have suffered and have been gotten better from COVID-19, remember, we also need you to consider a donation of plasma. You can get more information at southtexasblood.org. And if you have suffered in other ways, economically, you've lost job, if you are a small business owner, need assistance, the city and the county and the community are working together to provide small business grants. We're also working together to ensure that people have a safe way back to work. And you can get information about our Back to Work program to help with job training for job opportunities that are available right now in our community by calling 210-224-HELP for the job training program here in San Antonio. As always, you can get the latest on COVID-19 and other information on our website with assistance programs at covid19.sanantonio.gov, or you can text COSAGov to 55000. Dr. Aga, myself, and the judge are available for questions.
Is there an update on the latest numbers of COVID-19 cases in schools?
That will be tomorrow, as the mayor and judge mentioned.
Dr. Aga, for parents deciding if their child should return to in-person learning, a lot of parents are making that decision this week.
This briefing is continuing right now at KENS5.com and on our Facebook page. To quickly recap some of the numbers we just heard, 63 new cases brings us to a total of 57,208. Good news today, no new deaths to report. While we did see a backlog over the weekend be updated, 1,130 people have died in San Antonio and Bexar County from the coronavirus. Some good news tonight. We are seeing great news with our progress and warning indicators. COVID is still present in our community, but at a low risk level. You're still encouraged to wear a mask, practice good hygiene, and practice social distancing. But that positivity rate, it's at 5.9%. Our goal is 5%. So a lot of people doing the right things, and all these numbers moving in the right direction. You can see the full story on all of this at KENS5.com and the KENS5 app. We'll be right back after this break.